Hi and welcome to this video where I specifically want to give a shout out to dietitians. So last week it was officially in the UK National Dietitians Week, and if you are in a hospital, if you work in one, or unfortunately maybe you had to be there for any other reason, you might have seen a stand, you might have been able to try some nutritional supplements, you might have been invited to eat some cake, you might have heard about some cake competitions that the dietitians in that hospital or in that community setting might have been engaging with. And it's really a great time to highlight the profession and to let people know more about the services and the work that dietitians do. So I just want to continue the celebrations via YouTube. So I cannot offer you any cake physically. I can give you a recipe perhaps, and I cannot send you any supplements to try. But what I can do is just provide a little bit of education as to exactly explain, what is a dietitian and what does a dietitian do. So in the UK, dietitian is a protected title by law, which means that there's quite a rigorous process in order for one to obtain this title, and this is really for the welfare of the public, because dietitians are a health professional that can diagnose and treat nutrition related problems. So every hospital will have a dietitian there, and they work often as part of a multidisciplinary team. So that would be your nurse, your doctor, and your other allied healthcare professions, such as your physiotherapists, your occupational therapist, speech and language therapist, and so on and so forth. Now, the word dietitian and the word nutritionist do have a similar connotation, and I just want to clarify a few differences between the two. So a dietitian often will work in a medical related area if they are not working in research or public health. So a lot of the time they will be working with patients to manage and treat their condition. If they're not in a hospital, they might be working in a GP surgery, and if they're not working directly with patients, they might work in research. A lot of them do. We need that a lot. And they might work in public health settings, also diagnosing and treating nutrition related conditions on a community, on a mass scale. A nutritionist is not a protected title. However, there is a official register which does have their own regulation process, so that you can understand what kind of accreditation your nutritionist has. But signing up to the accreditation is not compulsory. So if you're seeing a nutritionist in the UK, then the idea is as to why haven't they signed up to this regulatory board, so that as a body, as an organization of nutritionists who regulate that profession, that everyone is meeting the required and recommended standards. So nutritionists, they often also work in public health settings, and they also often work in research. These are nutritionists who have gone through a nutrition degree program, whether that is through a bachelor's degree or through a master's degree. Now, there are some courses that people can take online which are increasing a person's understanding of nutrition, but it is generally thought that it is not the same type of scientific training that one would get through a 3 or 4 year program. It makes sense, doesn't it? Getting a certificate in 1 month, in 1 week, in 3 hours, it's not the same training as having to go and study, really understand, take time, go through assessments, and so on and so forth. So there is quite a difference, but you may not know just through the word nutrition. So if you are seeing a nutritionist, or if you're researching a nutritionist or some sort of program, then it would be good to understand where they're getting their information. So nutritionists and dietitians will recommend scientific evidence-based practices. This is similar to what your doctor, your nurse, or any person you'd see in a health setting. This is the type of information that are giving to patients. But not all nutritionists would be using the same type of information. So that's something really to consider. Nutritionists can work in healthy eating and giving healthy eating well advice. However, when it comes to the medical side of things, say a person has irritable bowel disease, say a person has blood pressure, diabetes, they're in intensive care unit, a nutritionist cannot work in this setting. And often there are nutritionists who have done their nutrition degree and then they go back to university and they get a dietetics master's or degree so that they can work in this kind of setting. And similarly, a dietitian may be working with patients, whether that's inside a hospital, in a clinic, and they might say, actually, I really want to go into more of a public health setting or more of a public health government setting, but they spent years maybe in the NHS or in private health. They may also want to go back to university and just skill up and just see, if that's really what they want to do, and just give them the competency and the confidence to go forth in that direction. So I hope that that's clear on the difference between a dietitian and a nutritionist. They are wonderful professions, and I know nutritionists, and they are doing fabulous work. They do awesome things. So it's not to say that one is better than the other, but it is to say that there is a difference, and depending on what your needs are, depending on what you're looking into, this is a good piece of information to be aware of. Well, happy dietitians, or shall I say belated dietitians week, because it was last week. It's such a wonderful profession. If you are thinking about maybe a career change, maybe you're thinking about, working with people, learning more about health and nutrition, I would recommend you to go to the BDA website. This is the British Dietetic Association. They have really good information about what is a dietitian and, trying to understand what are the various areas. It's not just, yes, healthy eating is around living well, healthy eating, weight management, but this is just one area of so many that you could potentially be working into, especially if you're into maybe biology, clinical sciences. Maybe you're thinking about being a pharmacist or a nurse. Think about being a dietitian as well. Okay, awesome. Well, thank you so much for watching, and I look forward to sharing in another video.